Good morning, everybody. Today we want to talk about a condition known as glaucoma, which affects the eyes and causes blindness. Actually, glaucoma is the major leading cause of irreversible blindness in the world, and it is more common in black people, in the Negroid race all over the world. Glaucoma is actually a group of diseases that affects what we call the optic nerve. That's the nerve that connects the eyeball to the brain. It's a channel that takes messages that the eyeball picks up, takes them to the brain so that the brain can interpret those images. When there's damage to the nerve, that tract is cut off and effectively the eye cannot see. Now, glaucoma, I'll give you some statistics about glaucoma to show why it's so important. There are about 1.5 million Nigerians who have glaucoma. And 5% of adults who are over the age of 40 years have glaucoma. This is what a national blindness survey in Nigeria recently discovered. Only 5% of those who have glaucoma know that they have the disease. And 1 in 5 of those with glaucoma are already blind from the disease in both eyes. We mentioned these statistics to show the severity of the problem. And it's so bad that all over the world that the WHO celebrates a week every year for the purpose of increasing awareness of the society, of the people in the general public about the condition. The reason being that glaucoma doesn't have very obvious symptoms. It's called the silent thief of sight because the damage occurs without the individual being affected knowing until it has reached very late stages. And then symptoms. The first one is usually that the person is not seeing well anymore. Pain may be associated with it. You just find that somebody notices that as they walk around, they keep knocking into objects. And that's typical of glaucoma. The people who have glaucoma, we describe them as people who have a searching gaze. And I will explain why this is the case. Normally, as we know, if we close one eye, we find that we can see to a certain extent. If I close the other eye, it's the same thing on the other side. And the two images fuse together to give us a wide, what we call visual field. But if glaucoma affects the nerve in the eyes, we find that the field gradually becomes narrow. So that the amount of the width of the visual field gradually narrows. It gets narrower and narrower and narrower until it becomes what we call tunnel vision. That's the point at which a lot of patients come to the hospital. Unfortunately, glaucoma, as of now, is not curable. Because of that, it is advised, especially in the black race, in people who are over 40, if people who have any family history, there's any member of the family. It can be somebody's grandmother, great-grandmother. As long as the person is related to the individual by blood, that person has a high risk of also developing glaucoma. The person's children, the person's grandchildren, great-grandchildren, they all have a high risk. And that's why such individuals need to take time, once or twice a year, to go and have a checkup. Where should the person who has glaucoma go? That's another very important question. Especially in our society where people go for treatment for medical conditions from all sorts of places. It's strongly advised that for glaucoma, you should see the people who are trained to diagnose and detect and treat glaucoma. And there are two main categories of people. We have optometrists who are, paramedicals. They are trained to be able to recognize and detect glaucoma. But after having done so, the optometrist will now refer to the medical specialist who is really the person who treats glaucoma. So we have medical doctors who have graduated with general medicine, and some of their colleagues decided to specialize in obstetrics, some in taking care of children, and then some others decide they want to specialize in taking care of the eye. So for treatment and surgery, those are the people, the people who finally have to take control of the treatment of glaucoma. We could treat it medically, we could treat it surgically. And all over the world, you can imagine, for such a condition, so much research is going on. We don't have a simple one-time solution. There are so many, and each one many times is tailored according to the patient and what that patient needs.